I want to talk for a few minutes about airborne diseases. These are pathogenic agents that are transmitted generally by aerosols that are produced when people sneeze or cough, but also can be transmitted by direct contact when you sneeze or cough into your hand, then shake hands with another person, touch another person, and transmit the infectious agent. The first one I want to talk about is measles. Measles has been around for a long time. In fact, if you look back in history, measles had a profound effect on the history of the Americas when it was brought to the native population by the Europeans. Measles today is a disease that is not particularly common because we have a very effective vaccine. Measles, though, is highly communicable with a transmission rate of over 80% between an infected person and an uninfected person. It's caused by a virus. It has a lot of names, including common measles and 9-day measles. And usually when you get measles, it's not a huge issue for most kids. They get the rash, they have malaise, they have a fever, and they recover. But a lot of these airborne diseases fall in the category of childhood diseases and have, as a result of this, complications that are very serious. And measles is one of these. The measles virus can infect the brain, causing encephalitis. And a fair number of measles cases, maybe 1 in 1,000, this occurs and the child can get brain damage or even die. The measles virus can also cause deafness. So it's these complications that concern people when measles starts being transmitted from one person to another. Fortunately, we have a very effective vaccine that can be given fairly early in childhood to make a child immune to measles. Occasionally, measles crops up again if you don't get adequate boosters in populations, teenagers, and college students. The next disease is rubella. Rubella is an interesting disease. It's called German measles or 3-day measles. When people get this, it's a fairly mild infection. It does only last about 3 days. You get a mild rash. But the complication of rubella that is so serious is the fact that it can go across the placenta. So if a pregnant woman gets rubella, the virus can go across the placenta and infect the embryo or the fetus, causing devastating symptoms, including death, or if the child is born, they can have brain damage or heart damage, blindness or deafness, or any combination of those. So it was very important to develop a vaccine, which was done in the 1960s, for rubella to prevent this from occurring. And then once the vaccine was widely administered, the number of congenital rubella cases went down to nearly zero. Another disease is mumps. This is also caused by a virus, just like German measles and measles. This virus has a propensity for infecting organs, and the one organ that it really likes to infect are the parotid salivary glands located back here, the upper part of the throat. And so that's the classic symptom of mumps. These glands swell up and constrict swallowing, and a very irritable complication or symptom of mumps. But mumps can infect other organs. The mumps virus can infect the testicles in adolescent boys and even a little bit older, causing swelling and eventually even sterility in infected individuals. The mumps virus can infect the pancreas, resulting in type 1 diabetes. And the mumps virus can infect the brain, causing encephalitis. Mumps was a leading cause of viral encephalitis before the vaccine. If you look at the vaccine now, we have an MMR vaccine, a measles, mumps, rubella vaccine that we give to all infants, and it's effectively lessened these very serious childhood diseases with devastating complications. Chickenpox. Chickenpox is caused by a virus that has the capacity to integrate into the DNA of our cells, doing both the lytic and the lysogenic cycle. As a result of this, when you get chickenpox, you have this very annoying and itchy and sometimes almost debilitating rash of pustules that cover your body and can result even in some mild scarring. But what happens later in life after you recover from chickenpox is that the virus DNA is in the nerve cells of your body, and when it becomes reactivated, we call this reactivated chickenpox infection shingles. Fortunately now there is a vaccine for chickenpox, And if you're vaccinated for chickenpox and you do not acquire chickenpox, then you will not get shingles later in life. Next thing I want to talk about are streptococcus infections. When you mention streptococcus infection, you think of strep throat, which most of us have had at least at one time or another. A very painful, sore throat that usually can only be cleared up effectively with antibiotic treatment. I'm sure most of us have had our throat swabbed and had this diagnosis of strep throat. The thing about strep throat, because the organism is right there in a place that's not very accessible to your immune system, is that you can have strep throat more than once. But it's the complications of a strep infection that can be even more devastating. For example, scarlet fever. Once you get strep throat, the strep organism can cause more serious symptoms, such as scarlatina, a mild form of scarlet fever, or the more serious scarlet fever, which can have serious consequences. And in about 3% of the population, the antigens that stick out of their heart valve tissue are identical to the antigens that stick out of the streptococcus. So when you get strep throat, the antibodies that you make to fight the strep throat also attack your heart valve tissue, ending up in you having a case of rheumatic fever, which can be very devastating. In addition, there's a strain of streptococcus called Streptococcus pneumoniae that's the leading cause of pneumonia among individuals. This organism produces a very slimy outer capsule. It lives in the alveoli of the little air sacs in your lungs and produces this capsular stuff. And as a result, you literally can drown in this microbial slime. Streptococcus, therefore, is the cause of over 50% of all pneumonia cases. Fortunately, there's the Pneumovax vaccine that can be taken, generally recommended for people 50 and older, and will dramatically reduce the likelihood of getting this form of pneumonia and even succumbing to it. Another airborne disease is whooping cough, or pertussis. This is the P of the DPT vaccine. Some time ago, years ago, the pertussis vaccine had some side effects that were serious. The vaccine now has been re-engineered, developed, and is much safer. Whooping cough before the vaccine was such a devastating disease, particularly among infants, that it killed 4 times as many children as all other childhood diseases combined. This organism would get in the respiratory tract and just cause a devastating form of pneumonia with this cough, where the name comes from, this whooping cough. Children would cough themselves unconscious and turn blue and then begin to come back from that experience, and this would just continue to cycle with the disease. Of course, now today we have a vaccine for whooping cough, and cases of it are not very common, but occasionally we get outbreaks of it in newborn nurseries and so forth in hospitals. So it's important that we maintain the immunity of our general population. Just a couple of more airborne diseases here. The list is pretty long. I think we'll just talk about a couple of others. One is tuberculosis. Tuberculosis worldwide is a devastating pandemic disease. This organism is very difficult to treat. It's caused by a bacteria that's closely related to the organism that causes leprosy. This organism gets in the little air sacs of your lungs, and then it can wall itself in there with the calcified scar tissue, making it very difficult to deliver medication to get rid of it. Slowly over time, it destroys your lung tissue, which cannot be restored, and can also infect other parts of the body too. Tuberculosis is common among impoverished people, places where they don't have good nutrition. Developing countries is very common. It's very common among the strata, even in developed countries that are socioeconomically deprived, and found among people with compromised health, like alcoholics and transients and so forth. The real difficulty with tuberculosis, one, is that this strain has picked up a lot of drug-resistant genes, so it's very difficult to find medications to treat it. And number two, because of the fact that it can wall itself off in these air sacs, you have to get treatment with 3 different antibiotics every day for 6 to 9 months to have an effective cure rate. That's very challenging among certain portions of our population. Then there's influenza. Probably no disease that we know of currently, perhaps HIV, causes more devastating pandemics than influenza. We devote a lot of time and resources in the public health arena, both the Centers for Disease Control and the World Health Organization, into monitoring influenza. That's because this virus mutates so rapidly. And it's also a zoonosis. The virus is actually a bird virus that can mutate in birds, and then it can infect pigs and horses and mutate in there and recombine with other influenza viruses. So it's constantly changing the antigens that are on its surface. And from one year to the next, you cannot be immune. If you became immune to an influenza strain last year, the new mutant strain, you would have no immunity against. That's why we have to get an influenza vaccine every year. And inside that vaccine are 3 different strains of influenza that are the best guess, the best scientific guess of the Centers for Disease Control about the strains that will be causing the most problems that year. In addition, there are now strains of influenza that can go directly from the bird to the human, bypassing the pig and duck bird flu. And of course, in 1918 and 1919, influenza caused the greatest recorded pandemic in the world, with estimates of 30 million people succumbing to this virus. Therefore, we really have to keep an eye on influenza. We have in the United States somewhere around 25,000 deaths a year from influenza. Finally, I want to mention the common cold. So we've all had the common cold, and we keep, you hear occasionally, how come they can't make a vaccine against the common cold? Well, the answer is pretty simple. There are about 120 different viruses that cause what we refer to as the common cold. So it would be very challenging to make a vaccine against 120 different viruses. Every year, each individual averages about 2 of these cold viruses a year. So if you do the math, it will take you 60 years to become immune to all of the cold viruses. Also, the common cold and its symptoms can be easily confused with influenza, but they really have somewhat different symptoms. A common cold usually only lasts 2 or 3 days versus influenza for a week. But perhaps the most interesting thing I think about the common cold is the effect it has. If you look at all the infectious diseases in the United States, the common cold has the most profound economic effect based on hours lost at work from having the common cold. Well, these are just a few of the airborne diseases I wanted to mention. If you look at airborne diseases, you can see that they've had very serious consequences over the years, and we've worked very hard as a public health community to develop vaccines to lessen their impact on individuals and their health.